Before we check in with the health department on this Wednesday, I spoke with Dr. Holly Phillips about some ideas to help us as we safely reopen and get out and explore our new cities again with this new normal. She tells us how we can do this safely. Here's more.
Right now, society is reopening and adjusting to the new normal. Here today with us is Dr. Holly Phillips, and she is sharing steps to follow as states open and how to safely get back on track with your health. Dr. Phillips, thanks for joining us.
Thank you so much for having me.
So there are so many things going on, and as we're trying to adjust to this so-called new normal, but also at the same time reduce spread, what can we do?
You know, I think we've all been so looking forward to this big reopening and getting back to some form of normal. But I think we should acknowledge that, yes, we're opening up slowly, but it is not business as usual. So just because you can go outside and do things you couldn't do a month ago, it doesn't mean you should do everything. I think we still need to kind of pick and choose. We need to keep in the forefront of our mind the virus is most contagious between people who are in close proximity. That's why that 6-foot rule isn't going anywhere. But also people who are in close proximity for 15 minutes or more. We now know it's very unlikely that you'll contract coronavirus just by walking past someone on the sidewalk. But if you're sitting with someone in close contact for 15 minutes, that's when contagion really starts to rise. So basic things, if you decide you're going to go to a restaurant, it's a good thing now it's summer, maybe opt for the outdoor option. If you see the restaurants not following social distancing measures, servers aren't wearing masks, personally, I would choose another place to go. But ultimately, I think we've just got to be open and kind of comfortable with this new reality that we're all experiencing. Like we used to grab our keys as we left the house, now we need to get used to grabbing our keys, our mask, our gloves, our hand sanitizer, just so we can be ready for whatever we might encounter.
And some people, depending on where they live, are able to get back on track with their wellness exams, dentist appointments, elective surgery. What safety measures should we be prepared to take when we're going to these visits?
Sure. So just as I said, just because we can do things doesn't mean we should. This is one that we should. I'm a general internist. I know how many of my patients have fallen behind on critical, just annual physicals. They can't get into specialists to see their cardiologist. Kids have fallen behind on vaccines. So as we're reopening, I think at the top of our to-do list, putting some of those medical appointments there is the right thing to do. But instead of booking online, I suggest you call your doctor's office or your dentist, whichever healthcare provider you're going to see, so you can ask questions. Ask them what social distancing measures or safety measures they have in place, what they're expecting of you. They might want patients to wait outside rather than in their waiting room. They'll text you when it's your turn. Should you come a few minutes early? And it also gives you a chance to tell them things. Most importantly, if you have any symptoms of cold or flu, if you've been exposed to anyone who could potentially have coronavirus, a lot of offices are separating appointments for patients who believe they're completely healthy and they're just there for wellness visits, and patients who could potentially have coronavirus. By separating those things out, we're keeping everybody safe. So I think it's important to call, communicate, and of course, wear a mask.
And for those people who are struggling with unemployment and are worried about their health care options because they may not have insurance, what can they do?
So this is one of, I think, the greatest challenges of this coronavirus pandemic that we're facing. It added insult to injury. Right when we needed our health care the most, we're seeing high levels of unemployment or people being furloughed and losing their health insurance. on our website, there are a number of pieces and resources that list low-cost options for even temporary insurance for people who might need it. There are resources listed for primary care, vision care, dental care, mental health, which is really critical now. And there's also information on how to save on prescriptions. Even if you have insurance, your insurer might not cover your prescriptions. So using the RxSaver tool, you can see the lowest retail prices at pharmacies near you. Retail prices can vary from pharmacy to pharmacy, even if the pharmacies are across the street. So you can find out the lowest retail prices to get the best, so you're paying the least if you have to pay out of pocket.
Anything else we should know before I let you go?
Just to stay safe. There's a lot more information just about coronavirus, getting health care, and getting our prescriptions covered right on our website at RxSaver.com.
Thank you so much for this good information to help us with our health as we adjust to our new normal. Dr. Holly Phillips, we appreciate you talking with Park City Television.
Thank you so much.